Clinical research is also being done on the use of iPS cells for the retina at the back of the eye. In 2014, the Kobe City Eye Hospital became the first facility in the world to start retinal transplants using iPS cells. So far, it has performed the procedure on 10 patients with severe conditions. These transplants prevented what was considered an unavoidable decline in their eyesight. None of the patients experienced serious side effects. Since 2020, the hospital has been at the forefront of global efforts in using iPS cells to treat retinitis pigmentosa. This is an intractable disease that occurs when the cells in the retina are damaged. The number of light-sensitive photoreceptor cells decrease, and vision gradually declines. There's no treatment yet that can lead to recovery. Because the retina loses function upon a person's passing, transplants from donors are not possible. Nomura has been battling retinitis pigmentosa for over 40 years. He currently leads a patient association. Retinitis pigmentosa can make it difficult to see in the dark. Other symptoms include a reduced field of vision and weakened eyesight.
紙の筒を丸めて覗いて外を見てるみたいなそんな見え方になるんで非常に不便ですね。例えば電信棒にぶつかってしまったりいうようなこともありますね。いつか失明するんじゃないかと思ったらちょっと非常に怖かったです。
Nomura has lost most of his eyesight. He can only tell if it's light or dark. To treat this challenging disease, clinical research is underway on transplanting retinal cells made from other individuals' iPS cells. The doctor leading this effort is Hirami Yasuhiko.
移植するのはその iPS 細胞から作った網膜の組織なんですけれども、網膜のシートと我々は呼んでまして。
This is a retinal sheet. First, iPS cells are turned into what resembles a three-dimensional retina. Cells that can sense light and those that will mature into the retina are extracted from this 3D retina. They are used to create a retinal sheet with a diameter of 1 millimeter. During surgery, this sheet is transplanted into the patient's retina at the back of the eye using a syringe. The retinal sheet is thought to act as a replacement for lost photoreceptor cells. The sheet gradually starts communicating with nerve cells. This is believed to lead to the eventual improvement of vision.
網膜シートを移植することで、その移植された網膜シートに含まれる、光を感じる細胞がですね、患者さんの残った脳につながる神経の一部と接続して、でそこへ光を感じることで脳の方に実際に光の信号として伝えられるんじゃないか、つまり患者さんが光を感じるようになるんじゃないかと。
The research team did experiments, transplanting retinal sheets made from iPS cells into mice with retinitis pigmentosa. They found that 4 of the 10 mice became able to sense light. After 8 years of animal testing, retinal sheet transplants were done on 2 patients, one in 2020 and the other the following year. This image shows a cross-section of a patient's retina. Before the transplant, it had become thinner due to a reduction in photoreceptor cells. After the transplant, the parts where the retinal sheet was inserted became thicker. A year later, these areas remained stable, indicating that the sheets had become part of the retina. In this surgery, only small parts of the retina were transplanted, rather than the entire structure, for safety reasons.
今回その移植後にですね患者さんに対して重大な副作用といいますか悪いことが起こっていないということも確認できましたので、さらに大きな網膜の広い範囲を覆うようなシートであったりとかより患者さんの神経との接続が効率よくいくようなそういった研究成果を応用した網膜のシートを移植できるようになれば、ひょっとすると、患者さんの視力が上がるといったようなことが観察できるかもしれないというふうに考えています。
ちょっとでも見えるようになったら今の不便さがちょっとは改善されると思ってます。もっとその進歩して見えるようになっていければいいなと思っております。
Japan is at the forefront of regenerative medicine, and regenerative eye therapy using iPS cells is progressing towards practical use thanks to the dedication of doctors and also other researchers. And we look forward to further developments both in Japan and also overseas to benefit the many patients in need of treatment.